Attention, all medical staff. Trauma code for children.
For the first time, we gain unprecedented access into Singapore's largest children's intensive care unit.
Syringe blood.
Working in the ICU, even if your feet are paddling furiously underwater, you have to still be able to perform efficiently.
Stats are improving.
Over 22 doctors and nurses work together every day to save children on the brink of death.
Why not me? Why my son?
There is no room for mistakes.
Intubating the patient.
We are like the gatekeepers. They are the last line in this hospital.
There are no easy decisions.
We may have to let her go.
We reveal the daily fight for survival of these little warriors.
You're doing very well. So brave,
And the staff who care for them.
你累的时候你要跟我讲，你要跟我讲。
I think every one of us has to have hope.
You've been fighting all along, right? You cannot lose hope, okay? You understand?
Inside the children's ICU, 22 doctors and nurses work round the clock, caring for up to 16 critically ill children, many of whom return to the KK Women's and Children's Hospital frequently. Discharged only a month ago, 3-year-old Aulia is back for a medical procedure.
Don't cry anymore.
All right, shall we? We're going to move on bed, okay, darling? Okay, it's already unlocked. Let's go. 1, 2, 3, go.
Aulia is at the hospital to replace her central line. A tubing inserted into her vein. This tubing is little Aulia's lifeline. She depends on it to deliver her medicine. An infection had caused the original line to be contaminated.
Coming already, don't cry.
While it was only a 2-hour operation, this is no ordinary procedure.
Let's see for you. Which one you want? How are you? You okay? Yes? Okay, good.
Aulia has childhood leukemia. And any procedure is risky because of her weakened immunity after chemotherapy. So she has to recover in one of the ICU's isolation rooms.
Okay, don't cry anymore, okay? No. Okay, dah. Okay, Auntie Nurse help you, okay? Don't cry, Aulia.
In general, children are admitted to the ICU if their condition is unstable.
Doesn't matter. Either way.
And they require the expertise and the technological support that ICU can offer. Or they have conditions which have the potential to deteriorate and destabilize.
Yeah, syringe blood. Syringe blood.
Earlier monitoring in the ICU can help to try and either prevent that from happening or be able to act faster if that actually happens.
As she recovers, Aulia will need advanced monitoring, which is not available anywhere else in the hospital.
Being hospitalized in this unit means that usually the patients are having these life-threatening conditions, so parents tend to be very stressful and very anxious. We need to be always with them to actually provide reassurance with them.
Unlike other nurses who have to care for up to 5 patients, The children's ICU nurses are in charge of only 1 or 2 patients.
You have to clean up properly. Dah jadi kau ini je. Jadi kau, jadi kau. She was ready.
No, medium.
Oh, Dr. Su is here. Nantilah, doctor's coming in. Wait first. Doctor check here.
Alia, can you tell me got any pain here or not?
Pain.
Yes or no?
Pain.
I'm sad that this thing happens to my only child. Yeah. Are you okay? Yes? Alright. Okay, you have to be strong, okay? Later when you're okay, I'll buy for you more toys, okay? Then we can go a lot of adventures, right? Where do you want to go? Where do you want to go? You want to go Disneyland? Yes? Okay, we'll go see Disneyland later when you're okay, right? We're going to see Minnie Mouse and Mickey Mouse, okay?
Of course, we want the best for Aulia, so that she can be a normal kid, enjoying her childhood. Yeah, and I think no child should should have this kind of sickness, disease in her for a young age. Yeah, yeah.
You've been fighting all along, right? So you have to fight more. Okay, we're almost done. We're almost done with this, and then you're okay already. Okay? You cannot lose hope. Okay? You understand?
We can't take away the fact that their loved ones are critically ill, but our team does understand that this is very overwhelming, and so we try very hard to support the families and the patients and try to make it as positive an experience as much as that can be done as possible. The intensive care unit is a place where we see a wide variety of often intense emotion. Working in the ICU, you sort of have to be the calm center in the eye of a storm.
You stabilize? Yeah, sure.
Even if your feet are paddling furiously underwater, you have to, above everything else, remain very calm and still be able to perform efficiently in a very high-intensity, dynamic, fast-paced working environment that is the intensive care unit.
Dr. Sudipta is the newest member of the children's ICU team, and this is what her life will be like for the next 3 months.
Attention, all medical staff.
Whenever there is a medical emergency in a hospital, a code team is activated. If a child is involved, the children's ICU team on duty will rush to the patient.
This patient, who is a 10-year-old girl who fell 3 floors from the HDB flat, she's about 30 kilos. You have already sort of palpated possible depressed skull fractures.
This is not a real medical emergency, but a simulation exercise, also known as a mock code.
Stats are improving, 93.
This is Dr. Sudipta's first simulation exercise. She cannot afford to be overwhelmed, because there can be no room for mistakes in the ICU.
This is where very sick children come to be looked after, and you need to be able to cope with the challenges, the very real, fast, different challenges that looking after ICU patients entails.
Midas is 3 milligrams, Sux is 50 milligrams.
Alright, I'm reintubating the patient.
Reintubating the patient.
This is Dr. Sudipta's first week with the children's ICU. She's on a 3-month-long clinical rotation.
I was in neonatology, so I was dealing with very premature babies, and this is a different ballgame.
1, 2, 3, across.
The mock code practice is a luxury, because here in the children's ICU, there are no practice days.
It's a matter of between life and death. A lot of the patients here, we are like the gatekeepers sometimes, you know, they are the last line in this hospital.
As the hospital with the largest and most advanced children's ICU, KKH also runs a special Children Hospital Emergency Transport Service. When activated, the transport service will send the ICU team to pick up children from other hospitals who need critical care. When 3-year-old Harris arrived at the children's ICU from another hospital, he could not breathe on his own.
This mask is to give some pressure to the lung to assist his breathing.
Okay, I understand.
And also give some oxygen.
Harris was perfectly fine the day before. Then he suddenly ran a fever, and overnight he was suffocating. His mother rushed him to the hospital. Coincidentally, his father was in the same hospital, about to go for a heart procedure.
So I rushed down, I pulled out all my tube. Because the doctor said, no, you can't go. I said, no, my son is in emergency unit now.
So we thought initially it could have been due to a pneumonia or some form of an asthma exacerbation because he had a history of asthma. We monitored him and we noticed that more things actually manifested over the next 24 to 48 hours. His blood pressure also dropped, causing his organs to start failing. His liver, his kidneys, his brain itself, we were concerned whether there was any damage to the brain.
The children's ICU team is racing against time to find out why Harris's organs are failing so rapidly, so that they can save his life.
I feel very sad, very sad. In my heart, saying that, why not me? Why my son? You see? That's happened to me.
So we're actually still investigating the cause. It's very challenging because it was not the usual case that we see in ICU.
Also looking for answers, Ding Shan, who finds himself back for the 4th time in 3 years because of his daughter's long-term condition.
When the oxygen level dropped around 80, her lips will start to turn dusky and even blue, and her eyeball will start rolling out already.
The other aspect which is challenging for parents is really about the uncertainties of just what will happen to their child.
Hello. Hello, xin Liễu. Uống mũ than à? Uống mũ thầy à? I feel tummy? Okay? Okay, thank you.
3-year-old Sin Lin was born with spinal muscular atrophy. The rare genetic disease causes muscles to weaken progressively.
So when she gets sick with simple coughs and colds, she finds it very hard to cope in terms of just breathing. And she comes to ICU to get assisted support.
Still facing a lot of problems with the secretions only. This morning also had a bit of desaturation while physiotherapy.
How much?
The desat was lowest, like 39%. Yeah.
Desaturation is what happens when breathing becomes so difficult for Sin Lin that she doesn't have enough oxygen in her blood. It is the reason why Sin-Lin has been in and out of the hospital 15 times since she was born.
When we come and visit her at the ward, the first things that we always see will be her oxygen level. The ideal number will be 100. Sometimes when the oxygen level drops around 80, her lips will start to turn dusky and even blue, and her eyeball will start rolling out already.
To help her breathe, doctors hook her up to a mechanical ventilator, which pushes air into her lungs.
Okay, bye-bye. Bye-bye. Is it nice, the show? Got beautiful eyes? No eyes means what? Happy. Happy, yeah. Okay, enjoy your show. I come see you later, okay? All right, bye-bye.
For our team to be able to provide those monitoring and those sort of advanced life support systems, then our staff needs to be very highly specialized and highly trained to be able to know how to integrate all these systems and monitorings to be able to provide care for this group of patients as well.
This machine is a mechanical cough machine, and we use it during the session.
This machine helps Sin-Lin to cough out body secretions such as saliva and mucus, which block her airways.
Cough, cough, cough. Very good. One more. Okay.
But this machine is not enough. Sin-Lin also needs chest physiotherapy.
Can you close your eyes and sleep for a while? Close your eyes. Oh, good. I won't pet if you don't close your eyes. Close. Okay. She likes the petting. I think it's comforting. When we do this, we are actually draining the secretions, loosening it towards her main airways, and then we will suction her because she has a lot of phlegm. Like it will suddenly come out. See, just as we speak, some phlegm sneaking out. Sorry, auntie, just clear this one. Oh, coming up. This is very loose. She needs the lungs to be cleared quickly. Otherwise, she would actually have a drop in her oxygen levels.
She was actually admitted a few times in ICU already. As compared to the previous round of ICU admission, the doctors were telling me that she seems to have lesser strength and she seems to be weaker this time around.
The other aspect which is challenging for both children and parents is really about the uncertainties of what will happen to their child. Critically ill patients' condition can change at any point in time.
When 3-year-old Harris was admitted to the children's ICU, his organs were failing. Two weeks later, his condition has taken a remarkable turn for the better.
This is a stark difference from when he first presented, when he first tried to, wake him up. So definitely he improved significantly. He could have gone a different route.
How Harris became so sick was a mystery. After ruling out an asthma attack, the doctors tested for bacteria next. But the results were negative. So they did another round of tests, and this time, they got their answer. Harris was attacked by multiple viruses.
So there are 3 known viruses. One of them is quite popularly known to cause liver impairment and liver failure in children. One of the others would cause usually respiratory symptoms, meaning cough, runny nose, or asthma exacerbations. And the last one is known to cause diarrhea, which he also presented with initially. So all 3 of them actually were present in him, and it seems like it affected him all at the same time.
Identifying the specific viral strains early meant that Harris could receive antiviral medication in time.
Viral infections are one of the most common kind of infections you get. Most of them recover without any form of need for any support. You just need to support the symptoms of the child. So I would say that he definitely did a lot of fighting by himself.
When I see him open up his eyes, look at me, that's the most happiest time for me. You know, I start feeling like, you know, my tears going to drop. See myself there. But of course, I feel happy to see that, see the improvement, the changes in my son.
Bapak. Bapak. Bapak, okay? Okay, Bapak.
The first word that is spoken to me is, "Bapak, I want to go back." In Malay, Bapak, saya nak balik.
I think the worst is over, so I'm pretty happy how he has progressed. We are confident that he will improve gradually.
But the dream of going home seems further away for some. Sinlin's 5-year-old sister is here to visit. Usually, children under 12 aren't allowed in the ICU. But because of Sinlin's worsening condition, an exception has been made.
Go home, baby.
I don't know. You ask me.